Hello, I'm Dr. Les Linet. I'm a psychiatrist, board certified both in adult psychiatry and in child and adolescent psychiatry, and I hope to help you understand psychiatric problems. I am participating in Speak Up for Kids, a nationwide education campaign for national children's mental health awareness, sponsored by the American Academy of Child and Adolescent Psychiatry, Child Mind Institute, Hunter Boot, and Parents Magazine. Millions of children in America have psychiatric disorders, and at least half will never receive help. Misunderstanding and stigma prevent parents from seeking help for many children who are suffering. I hope to help inform people that mental illnesses are real, common, and treatable. Unfortunately, bad things do happen. This could be the death of a loved one, accidents, war, natural disasters, terrorism. And because of the media, your children can be affected by this even if they are hundreds of miles away. I will focus on helping children cope with traumatic events. While we tend to think of an event as being the cause of a trauma, it's important to understand that it's not the event itself that makes something traumatic. It's really the subjective experience of the child that defines whether an event is traumatic or not. Trauma is really best understood as a failure to recover from the event, not the event itself. Let's start with what exactly makes an event traumatic for a child. On the slide, we see individual factors. For example, previous experiences, biological vulnerabilities. Event factors, close proximity, both emotional and physical, to the event are more likely to make it traumatic. For instance, rape is known to be one of the most traumatic events, as it is sexual and very personal. Post-event factors, whether a child has support from people close to him or her, especially the family, or whether there are additional stressors that are ongoing and that interfere with the ability to process and recover. What makes an event traumatic? The slide lists death of a friend, teacher, or family member, events seen or heard in the news, natural disasters, school shootings, terrorist attacks. At school age, children are more able to talk about their thoughts and feelings and can handle difficulties with better skills, but they still look to parents for comfort and guidance. Listen to them. Demonstrate to the child your strength and commitment to him or her. When scary things happen, seeing that parents can still parent may be the most reassuring experience a frightened child can have. How we can help. Acknowledge the child's developmental stage. At different ages and stages, kids react differently and may need different support to cope with a traumatic event. Some specifics we'll go over later, but as we consider several guidelines, remember, consider the child's age. Make your child feel safe. All children, from toddlers to teens, will benefit from your touch, extra cuddling, hugs, or just a reassuring pat on the back. It gives them a feeling of security, which is so important to the aftermath of a trauma. Act calm. Children look to adults for reassurance after traumatic events have occurred. Do not discuss your anxieties with your children or when they are around, and be aware of the tone of your voice, as children quickly pick up on anxiety. Maintain routines as much as possible. Amidst chaos and change, routines reassure children that life will be okay again. Try to have regular meal times and bedtimes, and stick with the same family rules, such as ones about good behavior. Help children enjoy themselves. Encourage kids to do activities and play with others. The distraction is good for them and gives them a sense of normalcy. Understand that children cope in different ways. Some might want to spend extra time with friends and relatives. Some might want to spend more time alone. Let your child know it is normal to experience anger, guilt, and sadness, and to express them in different ways. For example, a person may feel sad but not cry. Pick good times to talk. Look for natural openings to have a discussion. Listen well. It's important to understand how your child views the situation and what is confusing or troubling to him or her. Do not lecture. Just be understanding. Let them know it is okay to tell you how they are feeling at any time. More ways to help your kids. Acknowledge what your child is feeling. If a child admits to a concern, don't respond, "Oh, don't be worried," because he may feel embarrassed or criticized. Simply confirm what you are hearing. "Yes, I can see you are worried." Know that it's okay for you to answer, "I don't know." What children need most is someone whom they trust to listen to their questions, accept their feelings, and be there for them. Don't worry about knowing exactly the right thing to say. After all, there is no answer that will make everything okay. Realize the questions may persist because the aftermath of a traumatic event includes constantly changing situations. Children may have questions on more than one occasion. Let them know you are ready to talk at any time. Do not give children too much responsibility. It is very important not to overburden your child with tasks or give them adult ones, as this can be too stressful for them. Instead, for the near future, you should lower expectations, although it is good to have them do at least some chores. Give special help to kids with special needs. These children may require more time, support, guidance, and nurturance. You might need to simplify the language you use and repeat things. You may also need to tailor information to your child's strength. For instance, a child with a language disability may better understand information through visual materials. Help children relax with breathing exercises. Breathing becomes shallow when anxiety sets in. Deep belly breaths can help children calm down. You can hold a feather or a wad of cotton in front of your child's mouth and ask him to blow at it, exhaling slowly. Or you can say, "Let's breathe in slowly while I count to 3, then breathe out while I count to 3. Place the stuffed animal or pillow on your child's belly as he lies down and ask him to breathe in and out slowly and watch the stuffed animal or pillow rise and fall. Try to stay together with your child. This is usually best for a child's mental health. However, under extreme circumstances such as an earthquake, if separation is necessary, wherever children will have their basic needs met, feel safe, and have good caregivers, ideally with individuals they love and trust, is the best place for them to be. Take care of yourself. You can best help your child when you help yourself. Talk about concerns with friends and relatives. It might be helpful to form a support group. If you belong to a religious organization, you can use them. Try to eat right and get enough sleep. To reduce stress, do deep breathing. If you suffer from severe anxiety that interferes with your ability to function, seek help from a mental health professional. If you are a parent, your response to your child's trauma is the biggest outcome of your child's mental health. Your response is the biggest outcome. It would be helpful for you also to seek therapy, since a trauma that happens to your child traumatizes you. Continue on part 2, and thanks for listening.